TMS therapy. Frequently asked questions. What is TMS therapy? TMS is transcranial magnetic stimulation. The word transcranial means through the skull. The words magnetic stimulation mean that we use a magnetic pulse to stimulate specific areas of the brain connected to the depression circuit. This brain stimulation restores the brain to normal function. Who qualifies for TMS therapy? Today, TMS is FDA approved for the treatment of depression, OCD, and smoking cessation. TMS is also helpful but not FDA cleared yet for other psychiatric disorders like anxiety and PTSD. Currently, TMS is covered by most major insurances. That being said, insurance had set different criteria for who qualifies for TMS. Usually, if a patient had failed psychotherapy and medication antidepressants, then insurance will cover the treatment. How does transcranial magnetic stimulation work? There are specific areas of a depressed brain that are hypoactive, or sleepy. We use a magnetic pulse to activate, or wake up, those areas of the brain. This brings the brain activity back to normal. We do this repetitively to induce neuroplasticity in the brain tissue. This means that we generate new connections between these brain cells by repetitive stimulation of the brain cells. Think of TMS therapy as a workout routine. But instead of your muscles, it is a workout for your brain. You don't lift weight once and expect to build up muscle. Instead, you lift weight in sets. You do it daily for a few weeks to see your muscle mass growing over time. Same with TMS. We stimulate the brain repetitively for a few weeks to cause a long-lasting change in the brain. What should I expect during my TMS treatment? The TMS therapist will welcome you into a very calming room. You will be seated in a comfortable reclining chair. A magnetic coil will be placed close to the left frontal side of the head. That magnet will produce magnetic pulses that feel like gentle tapping on the side of the head. That tapping sensation is tolerated well by almost all patients. It does not require any type of sedation. The patient can return to their normal activities after the treatment session, which means that you can drive yourself back and forth to the treatment center. What does TMS feel like? The magnetic pulses on the side of the head feel like a tapping sensation. Some of her patients describe it like a woodpecker. Some others describe it as bubble wrap. But for the most part, most of our patients don't feel anything after about a few minutes because it disappears in the background because of what we call habituation, meaning that you get used to it. How is TMS therapy performed? TMS is performed in an outpatient office using a TMS machine or device. An alternating electrical impulse is run through a coil of wires. This will produce magnetic stimulation underneath that coil. That pulsating magnetic field goes through the skull and reaches the cortex of the brain, where it activates the brain cells or neurons. How do I spend my time during my treatment sessions? TMS is very calming for most patients. We recommend that you stay awake during the treatment, as research shows that an active brain, with psychotherapy, can respond better to TMS. You can use a therapy app on your phone during the treatment. We have large screen TVs in the treatment rooms. You can watch meditation videos, relaxation videos. Most of our patients end up catching up on their favorite shows on Netflix or Hulu. How long does transcranial magnetic stimulation take? Each session takes about 19 minutes. It is done daily, Monday to Friday, 5 days a week for 6 weeks. This is a total of 30 treatment sessions. Then we do 6 sessions taper off over 3 weeks. This is 2 sessions in week 1, then 2 sessions in week 2, then 1 session in week 3. How long does the effect of transcranial magnetic stimulation last? 2 out of 3 patients will keep their response in 12 months after the treatment. 1 out of 3 will have a recurrent depressive episode by then. So, generally speaking, if you respond well to TMS, you have a higher chance of staying well for the next 6 to 12 months. Those who have recurrent depressive episodes can be treated with TMS again. How many sessions does TMS therapy require? The standard course of TMS therapy consists of 30 treatment sessions in 6 weeks, followed by a taper-off course of 6 treatment sessions over 3 weeks. What is the difference between standard or rTMS and Theta Burst Stimulation? Standard rTMS takes 19 minutes to deliver one treatment session. Theta Burst Stimulation or TMS delivers triples pulses at 50 Hz frequency, a pulse pattern that the brain uses to communicate among its circuits. This means that we can be more efficient in delivering brain stimulation in a much shorter time. It is proven that 3 minutes of theta burst stimulation is as effective as 19 minutes of standard rTMS. Both rTMS and TMS are FDA approved for the treatment of depression. What is Navigated TMS? How does it differ from standard TMS? With Navigated TMS, we use 3D spatial cameras to track the positioning of the coil and the position of the patient's head in real time. This allows us to assure the most accurate positioning of the TMS coil at all times. With regular TMS, the coil is positioned and maintained in position by the treater eye. With Navigated TMS, the positioning of the coil is confirmed with the most advanced 3D tracking technology. This means that every single magnetic pulse is deprived exactly where it was intended, which increases the chances of successful TMS treatment and depression recovery for our patients. Does transcranial magnetic stimulation work for depression? Yes. TMS is FDA cleared to treat depression for those who don't respond to classical antidepressants. The success rate is reported to be 58% in clinical research. Our numbers are reflecting about a 70% response rate. Does transcranial magnetic stimulation work for anxiety? There is strong clinical evidence to justify the use of low-frequency TMS to treat anxiety. Unfortunately, it is not FDA cleared because none of the TMS manufacturers sought after an FDA approval. At Florida TMS Clinic, we offer anxiety and PTSD treatment protocol at no extra charge to our patients receiving TMS therapy for depression. Are there any side effects and contraindications of TMS? TMS is safe for most people. Patients with metal objects in their heads should not get TMS because of the magnetic field interfering with the metal. Patients with an active seizure disorder shouldn't get TMS either. The only significant risk with TMS is an accidental induction of a seizure. But that is extremely rare. It is estimated to be 1 in 30,000 treatments.